We're now joined by Estherlene Phanord, who is a health educator for Trusted Links. They are connected to the Partnership for Maternal and Child Health of Northern New Jersey. Estherlene, so good to have you with us.
Thank you for having me. It's a pleasure.
Describe Trusted Links.
So Trusted Links, what we are is we are a peer-to-peer education model where we train Black women specifically in New Jersey. We train about reproductive health. We train them about a healthier birth outcome. We teach them about nutrition, just different things about pregnancy in order to empower women, specifically Black women.
So we've talked about racial inequities, social determinants of health, social impact, et cetera, when it comes to healthcare. Women of color are impacted disproportionately in a negative way by the healthcare system.
Definitely, yes, we would agree with that.
And how does it play out in reality in terms of childbirth, in terms of reproductive, health education? Talk about it.
So some of the things that I teach at Trusted Links is we understand there is a great disparity. So when we look at childcare or when we look at Black women in Black childbirth, we see that, Black infants, they have a 3 to 3.5 times more likely to die than white infants. And we see that Black mothers have 3.8 times more likely to die than white mothers. And the way that plays out is we understand there is the stress of racism that can impact the way that a mother has childbirth. We understand there's implicit bias oftentimes. And that's why we at the partnership, we really try our best to implement professional education, implement programs that can not only tackle this idea or this reality of the disparity, but trying to find a resolution and a solution for it.
It's funny. I'm going to ask our team to put up the Confronting Racism graphic, because some folks might say, oh, well, Steve Adubato is doing something on healthcare. He's doing something about women of color and maternal health and its disproportionate impact on women of color. But this is confronting racism, is it not?
So the way we try to look at it is we understand that there is a stress that racism can play when it comes to Black mothers giving childbirth, or the impact that it has on a woman's experience on her child delivery or on everything. So we do understand there is an impact and there is an implicit bias behind it, yes.
And the support, you came to us through the folks at the Horizon Foundation. Does most of your dollars as a not-for-profit, do they come from foundations and corporations?
So most of our dollars, I'm not quite sure where they come from because my expertise is Trusted Link. However, they do come from people or different organizations that I believe that are committed to a cause. And we don't only work with, Black families or, Black mothers, but we do service and we do give our attention and resources to all women, families, mothers, children.
Devil's advocate, someone says, pretty much folks have to take care of themselves. There are some folks watching right now who say, hey, listen, I happen to be white. I happen to be middle class or upper middle class, whatever, but it's challenging for me too. Give us one concrete example, if you could, Estherlene, as to why it's specifically and concretely more challenging and difficult for a woman of color when it comes to reproductive health education and, frankly, childbirth.
So as some of us may know that Black women or Black people in general, sometimes we are more high risk to other things such as preeclampsia, which can lead to mortality. We are more likely to more likely to have premature babies. We're more likely to have diabetes and all these other health factors. And not only that, I also teach in the Trusted Links program that sometimes it isn't just due to the fact that, our economic status or our socioeconomic or our environment. Sometimes it is a big umbrella of things which we consider the social determinants.
Could be geography, could be your zip code, could be the inability to get the appropriate transportation. It could be what health organizations, hospitals, or whatever are in your neighborhood, and a whole range of other things, right?
Yes, so it can be an umbrella of things, different social determinants that can impact it, but we do see that oftentimes, the stress of racism, as we can see now, or we do see the implicit bias that we are trying to tackle and trying to work with hospitals and administration about, that also plays an impact with it too.
And you're making a difference every day. Estherlene, I want to thank you and your colleagues for the work that you're doing. I know you're going to keep doing it, and we'll continue to shed a light and share this story and make sure public policy makers understand how important this is, not just for women of color, but for all of us, because we are on this together. I cut you off. Final words, go ahead.
I was going to say that thank you so much for having me. You know, this conversation is a conversation I'm so happy that we are in the current state now. That is a more prevalent conversation. You know, since 1992, we've been doing this work and trying to figure out how we can make the quality of care for women, for children, for pregnant moms and new moms a difference. So thank you for shedding the light on this conversation. And hopefully this conversation can, you know, extend farther out and we can really make a difference.
Well, that is why we're here. Estherlene, thank you so much, and we wish you all the best.
Thank you. Have a great day.
You too. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, PSC&G, MD Advantage Insurance Company, ADP, the Healthcare Foundation of New Jersey, the North Ward Center, Johnson & Johnson, NJ Best, and by the Adler Aphasia Center. Promotional support provided by CIANJ and Commerce Magazine, and by NJ On Air.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.